Hello, my name is Julia Holland, and I'm going to be talking about using cognitive behavioral therapy for managing chronic pain. More than one-third of Americans suffer from a persistent or recurring pain known as chronic pain. This pain can greatly impact one's daily life and may even result in other serious side effects, such as depression, social isolation, and prolonged disability. Despite a lack of documented safety, opioids have been the cornerstone of chronic pain management for the past 2 decades. Although effective, opioids come with the accompanying risks of addiction, overdose, and sometimes even death. According to the Center for Disease Control and Prevention, more than 6 out of 10 drug overdose deaths involve an opioid, and 91 Americans die every day from opioid overdoses. In most cases, the potentially fatal risk of opioids far outweigh the uncertain benefits, which is why the CDC recommends that opioids should not be the routine therapy for managing chronic pain. In Have You Renounced Pleasure from the Book of Joy, Lasting Happiness in a Changing World, the Dalai Lama states that when you are joyful and happy at a mental level, the physical pain doesn't matter very much. In other words, the mindset of a person can have a serious impact on the way they perceive their physical pain. Pain catastrophizing is a negative mental state related to pain experience that magnifies the physical effects of pain. It occurs when the patient ruminates about the pain they are experiencing while feeling helpless to control it. Individuals who catastrophize over their pain not only experience various forms of dysfunction, such as depression and anxiety, but also respond poorly to medical intervention. Therefore, mental therapies targeting pain acceptance may aid patients whose mental states amplify and provoke their pain. These ideas inspire the question, can chronic pain be effectively addressed through the body's connection with the mind, as opposed to with harmful and addictive medications? Techniques which target mental well-being are safe and effective, drastically reducing or even completely eliminating the need for dangerous pain medications. One notable example is cognitive behavioral therapy, or CBT, which is a form of psychological treatment utilized by clinical psychologists that targets the way patients think and manage their chronic pain. James McAbee, a clinical psychologist from the University of South Alabama, explains that CBT focuses on the problematic thoughts and behaviors contributing to a patient's negative emotions and concerns. It helps patients understand that pain is only a stressor and that they have the ability to adapt and cope with it. It also challenges the patient to make changes in both behavioral and cognitive patterns, so it not only improves pain-related outcomes, but it also helps promote better mobility, mood, and overall quality of life. These outcomes can be seen in a study performed by Lin Yu and other researchers at King's College in London in 2017. Yu and his colleagues examined a total of 412 adult participants, measuring pain acceptance as well as treatment outcomes, such as social adjustment, depression, and pain-related interferences. These measurements were taken at 3 separate points throughout the experiment: before the treatment started, when it was completed, and 9 months after it ended. Overall, the results yielded impressive outcomes, with up to 67.5% of participants showing significant improvements, both immediately after treatment and at the 9-month follow-up. Dana Sudak from Drexel University College of Medicine further confirms the benefits of CBT, as she states, cognitive behavioral therapy is a useful and empirically based method of treatment for pain disorders that can decrease reliance on the excessive use of opiates. She goes on to provide more evidence to support the use of CBT to avoid or reduce opioid use for chronic pain. Beth Darnall, a professor of pain medicine at Stanford University, expressed concern in the nature of the treatment itself. In order to be effective, CBT takes work. It requires patients to show up consistently to sessions in addition to practicing on their own time. This commitment can seem overwhelming to patients who are already suffering from chronic pain, which is a major stressor to their mental resources. Many patients turn to opioids because they find them to be more convenient and effective in the short term. Despite the limitations, the methods used in CBT could help improve numerous lives in the future, and this technique will hopefully give those with chronic pain the relief they need without the serious risks of opioids. Cognitive behavioral therapy is a better alternative to opioids as it not only helps people manage their pain, but it changes the way people think about the pain. There is an urgent need for a shift from a pharmaceutical to a psychological approach for treating chronic pain. Incorporating CBT into more treatment plans can be the start of that shift, improving many lives for the better. Thank you.